Welcome back to the exchange. It's been rough and rougher for the healthcare sector lately. It's down 11% over the past year, while the S&P has gained 14. That's 25 points of underperformance. And my next guest says this is the worst the sector has traded ever. And it's time to JOT. Joining me now is Jared Holz. He's the healthcare sector strategist at Mizuho. I love the honesty, Jared, because you must be frustrated more than anyone. What has been the latest in this cascade of bad news?
For sure. Very frustrated. It would be great to, kind of cover a sector that outperformed once in a while. But when you go back and you look at healthcare versus the market over the past decade, even more than a decade, the only years in which it's outperformed, the market was down. So no one likes that setup either. A cascading effect of issues in large cap pharma, obviously. And then last week in managed care with what we saw out of Centene, Molina, Elevance over the past couple of weeks, it's just been brutal all around.
No, I mean, when you see Centene, I don't know exactly. I mean, is it down by 50%? It was down 40-something% in a day. It's almost like they're acting like the NASDAQ.com bubble exploded, but instead it just seems to be changing fundamentals with what? With Obamacare? What's it with Medicaid? Is it multiple of those issues stacking up? It's just these are huge moves for these stocks.
Unbelievable moves. I mean, United would probably be the biggest example. One of the largest companies in all of healthcare losing 50% of its market cap this year alone, which is just a phenomenal situation to see that happen for a company this large. Then you add on Centene and Elevance. Yeah, there's obviously higher utilization in the system. We've talked about that before. It's happened amongst a variety of patient subsets, and most recently, I guess, Medicaid has been the most pronounced, but there have been so many factors that have driven the sector lower.
Right. So, and again, higher utilization is just such a weird headwind to make a company lose half of its valuation. With Medicaid, I assume the challenges there include it being pulled back now as the GOP's bill has passed. So again, some changes with Obamacare and how much exactly is going to be covered there. So at some point, listen, if you and I are talking about it, there's got to be people who look at this and say, okay, finally, this must be some kind of entry point.
Yeah, I think there are investors that are starting to look at this space. I mean, the question is, are these value stocks? Is this a value trap? Are we setting ourselves up for another, difficult year? Because last year was a pretty rough year in healthcare as well. And 2023, the same thing. I think those 2 years, the sector in total underperformed the market by over 20% annually. And here we are in a similar boat. With respect to managed care specifically, I think we just need to see numbers reset, Medicare and Medicaid rates reestablished. Maybe the procedure volume backdrop improves in their favor. But there are a lot of variables we have to kind of get more visibility on before I think a bigger faction of investors are willing to take a look.